you have an afferent arteriole. This is where blood enters into the glomerulus. You can see the walls of some of these capillaries have been moved away, so you can see the red blood cells inside, and you can see the blood inside. These are fenestrated capillaries, so they do have holes in them. And you can see surrounding these capillaries are podocytes. And these are cells that help to create a filtration membrane. They have these little podocytes or foot processes on them that creates filtration slits. And I'm going to talk about that a little bit later. But what happens is blood goes in to the glomerulus, and then some fluid gets pushed out. And now we call that filtrate. And that can head into the proximal convoluted tubule. Now, if the fluid doesn't get filtered, then it's going to just head back out through the efferent arteriole and back into circulation. So the outer part of this renal corpuscle is known, let's see, put a whole thing around it here, is known as the capsule. Bowman's capsule is what it's often called. And that's what's going to capture the filtrate and basically let it head into the proximal convoluted tubule. This is what the renal corpuscle looks like under a microscope. So you can see the actual capillary part here, the glomerulus. You can see the capsule here lined with simple squamous tissue, and you can see this capsular space where the filtrate is going to go. And then over here you can actually see a segment of the renal tubule, which is pretty cool. So the glomerular capsule, the outer layer of it is actually simple squamous cells, which you can see here. And the glomerulus, the visceral layer, is lined with these podocytes. And you can see the endothelium lining of the blood vessel capillary walls is fenestrated, meaning that it has holes. And then there's a basement membrane in between those two. This creates the filtration membrane.